Hi everyone. So today I have Nicole Costello joining me. So Nicole works alongside me in my clinical practice and she specialises in SIBO. So welcome, Nicole.
Hi, Joanne. Thank you.
So Nicole, I just want to ask you, first of all, what actually is SIBO?
SIBO stands for small intestinal bacteria overgrowth. So it's dysbiosis of the small intestine, essentially. And what happens is these bacteria, for a myriad of reasons, take up residence in the small intestine where they're not meant to be in the numbers that they are. They are commensal bacteria, so they do exist in the large bowel, but they are found in the small intestine. And they take foods and they ferment, and healthy foods at that, onion, garlic, asparagus, and they ferment those foods into gases, methane and hydrogen. And those gases then damage the intestinal wall and cause a myriad of symptoms throughout the body.
Yeah, so what are the symptoms that you're looking for when someone comes into clinic and you think, oh, this potentially is SIBO?
So you've got the classic gastrointestinal symptoms of either constipation or diarrhea or a little bit of both, abdominal pain, nausea, excessive belching, flatulence, heartburn is another sign and symptom of SIBO. Then you also have systemic symptoms. So you could have restless legs. Rosacea is a SIBO symptom. So skin issues, itchy skin, eczema, insomnia. The list goes on. There's a lot of symptoms that are related to SIBO.
Okay, so when you talk about all this itchy skin and skin issues and insomnia, this sort of says histamine to me. Would you agree that this is a histamine problem that SIBO is causing?
Yes, absolutely. So SIBO. So what SIBO does is those gases damage the lining of the small intestine. They damage the intestinal wall. And wherever there is damage, there's inflammation. And wherever there's inflammation, there's an inflammatory response, and histamine is released by mast cells. Mm-hmm. Now, in the small intestine, you've also got the DAO enzyme, which is very important. It's the enzyme that breaks down histamine in the gut. Mm. And if there is damage to the gut and the brush border, then the DAO enzyme is not going to be working as well. So you've got histamine being created from the inflammation, histamine probably coming in from the diet in the form of histamine foods like avocado, tomato, banana, spinach. And then you've also got a problem with histamine breakdown within the small intestine, within the large and small intestine. So then you can't break it down and excrete it. So it's building. And then the other problem that SIBO causes is large bowel dysbiosis and leaky gut. Mm. So leaky gut is when your intestinal lining becomes hyperpermeable and toxins and food particles get through to circulation, and they're registered as foreign by the immune system. So then there's an inflammatory response, an immune response, and more histamine is being released by mast cells. And so then you get that buildup of histamine symptoms, histamine, and resulting in histamine symptoms, headaches, migraines, itchy skin, eczema.
Okay, interesting. So if someone presents in clinic with chronic skin issues, is SIBO one of the first things you'll look at?
Yes, along with the symptoms of the gastrointestinal symptoms. And then there's other little clues as well. Like sometimes people feel horrible on probiotics, or they feel fabulous on antibiotics. There's just these other little clues that can point to SIBO as well. Okay. Within the consultation. Plus, there's also a case history taken as well. High stress, finding the cause is another issue that we deal with.
What are the major causes of SIBO?
So stress is a major cause of SIBO. That's because stress decreases hydrochloric acid, and hydrochloric acid is antimicrobial, and so it kills off bugs before they can take up place in the small intestine. And it also causes a cascade of reactions that help and aid digestion. So the pancreas then releases pancreatic enzymes, which are alkalizing to the small bowel. And if they're not being released, then the small bowel is more acidic than it normally is, and allowing the bacteria to thrive. So stress, that's how stress and the lowering of hydrochloric acid can cause that dysbiosis in the large bowel very, very easily. Another example of another cause is food poisoning. Very common after food poisoning to get SIBO. This could be immediately, or it could be 3 months after the event. Another cause of SIBO is I'm just thinking, proton pump inhibitors, so medications. So lots of antibiotic use can cause dysbiosis, as we know, but also proton pump inhibitors. When you've had H. pylori infection, for example, you might, you would have done antibiotic therapy, plus you would put on proton pump inhibitors, and they, again, decreasing hydrochloric acid, allowing the bacteria to take up residence. And often people are put on proton pump inhibitors because they're belching and they have heartburn, but it's not because there's not enough. There's not because there's too much hydrochloric acid. It's actually because there's not enough. And it's histamine driving that. It's histamine with the H2 receptor and interfering with hydrochloric acid release that causes that problem. And then they get on the medication that actually suppresses hydrochloric acid even further, and the result is SIBO.
So Nicole, how would you deal with that in clinic if you suspect someone has low hydrochloric acid, but they're getting reflux and heartburn, and would they presume they've got high, and how would you actually go about dealing with that?
I go slowly. So start with diet. So we take the SIBO diet and treatment diet. We take FODMAPs out of the diet, and they're the foods that are feeding the SIBO bacteria. Clinically, we've also found rice and potatoes, so starchy foods feed SIBO, so they come out of the diet too. And then what I aim to do is basically lower anything that's causing any belching or heartburn. And if that goes well, then potentially that person may need hydrochloric acid supplementation and additional digestive enzymes just to get digestion flowing again, because I can tell that we've already worked out from the diet that all is okay, and that has dissipated. And that they're ready for some hydrochloric acid, but we go slowly. We don't just give somebody hydrochloric acid.
Okay, great. So Nick, what are the other causes of endometriosis? Because I know there's I just gave away one of the causes, endometriosis. So what are some of the other causes of SIBO?
So yes, endometriosis can cause SIBO because it leaves scar tissue on the intestine, and where there's kinks, or any structural or scar damage, there's potential for bacteria to hide in there and thrive and not be cleared out. Another major cause of SIBO is dysfunction of the migrating motor complex. Now, the migrating motor complex is a pulsing mechanism that pulses through the small intestine, pushing out pushing out any toxins, pushing out undigested food. And it's basically a cleaning mechanism for the small intestine. And when it works is when we're in a fasted state. So between meals and overnight while we're asleep. And so high snacking will stop that mechanism from occurring. So there's another cause. But other things that can cause that mechanism or interrupt that mechanism, a big one is food poisoning. And so is any spinal injury, whiplash. It's just the nerve conductions of that migrating motor complex that are affected, and it can cause dysfunction there. And if that's not happening, you're not pushing out the bugs, you're not pushing out the undigested food, and you've got this nice little stagnant place for the bacteria to grow.
Okay, interesting. So, Nick, what are you doing regarding testing for SIBO in clinic? Are you testing every patient that comes in for SIBO? What's involved with testing?
Yes, so we look based on case history and symptoms. I go through that, and then I do test for SIBO if I suspect SIBO, and we use a SIBO test that tests for hydrogen and methane SIBO. It's a lactulose breath test. You get sent it in the mail, and you can do it at home. And all it requires is a prep diet the day before. And that prep diet is foods that I don't really want you eating, but it's rice, white bread. You can have poached chicken. It's very bland. I think you can have clear bone broths. So a very bland diet for one day. Overnight fast of 12 hours, wake up in the morning, and over 3 hours, you do a series of 6 breath tests. You pack it all up and put it in the mail, and I get the results in about 3 or 4 days.
Okay. So what are you looking for when you get those results back?
So with hydrogen SIBO, you're looking for you're given a graph, and you're looking, and you take the breath test over that 3 hours. But I'm really keen to see what happens in the first 120 minutes, because that's where that's the small intestine. Wow. And if the hydrogen within that 120 minutes jumps at any point by 20 basis points, then it's indicative of hydrogen SIBO. Methane, I'm looking for a jump of 10 points, but methane's tricky. If methane is high and stays high, then, and you also have had good reactions on the diet I've put you on, then I would suspect methane SIBO as well. So methane can be high and stay high, or it's just a jump of 10 points, and that's methane SIBO. Okay. On the tests.
Right. So if methane SIBO stays high and starts high, stays high, even though it doesn't jump more than 10 points throughout that, it is still as considered positive.
Yes. So when I send you off for testing, after you've done the test, I also put you on our dysbiosis well, sometimes you need low histamines as well, but I put you on a dysbiosis diet, and it's our diet that cuts out FODMAP foods, and it also cuts out starch. And you go off and do that for 2 weeks. So when you get back to me, I've got a good idea of how you're doing on the diet. And I've also got the test results sitting in front of me. If your methane starts relatively high and stays high, and you've done really well on the diet, and your symptoms have improved, and you've seen a big difference, then we start treating methane SIBO. If methane SIBO is very high, then we start treating methane SIBO, even if there's no jump. Okay. Just getting the right balance with symptoms and the test result.
Okay. So with treatment options, there's obviously the diet, so low FODMAP, low starch, and low histamines for those that have histamine issues. Yeah. But what other supplements are you using? So what herbs do you actually use for the different types of SIBO bacteria?
Okay, so methane SIBO requires allicin and oregano. And hydrogen SIBO uses different herbs. It requires berberine and oregano. And that's how we treat, that's how we're killing off the bacteria. So the diet's starving and the herbs are killing off. Okay.
And what about patients that present with chronic constipation? Because I understand if you've got chronic constipation, you can't actually get rid of SIBO because you're not actually pooping out undigested food and bad bugs. So what are some of the options that you are using for bowels?
Yes. So like you said, pooping is of utmost importance. We want a daily motion. It needs to be formed, easy to pass, and you need to feel complete emptying. And if you've got all of those things happening, it means you're able to, when we're killing off the bacteria, you're able to get rid of it and the toxins as well. Now, if you're not pooping, we use a supplement called Cascara Complex. And it's a natural laxative, and it helps to get your bowels moving, and it helps with digestion as well. It helps stimulate digestive enzymes also. So that's one supplement. Sometimes people don't actually need that supplement, and they might just need to simply drink more water.
Yeah. Yeah, that's right.
Other times, SIBO causes a lot of nutrient deficiencies because when you think about it, you've got the damage to the small intestine is your biggest nutrient absorption organ. So you've got damage there, and that's affecting how much of the nutrients you're absorbing. So key nutrients that we often see that people are deficient in are iron, B12, magnesium's another one, and zinc. So sometimes I'm just giving magnesium to help to calm down people's stress or to help with their sleep is enough to also get their bowels moving.
Yeah. So magnesium is a great supplement like that. So Nick, how important is it to be compliant with the diet?
Okay, it's extremely important. With the diet, I'm looking for 95 to 98% accuracy. So it's key to treatment, and because we're using natural herbs, and the diet is starving, and we need to be starving, so then the herbs can just kill off what's left there.
Yeah,
and it weakens the back. By starving them off, you're weakening them as well, and it improves the efficacy of the herbs. So diet is of utmost importance.
So how do you know when to start reintroducing foods?
So we like to retest. It gives a patient peace of mind as well. But in retesting, we can see how effective our treatment was, how far the SIBOs come down, and if you are ready to, in fact, start having FODMAP foods again. So we go slowly. We look at the test result. If there's no more SIBO, no jump of 20, no jump of 10, then you're ready to start introducing FODMAP foods again. So you start with your onion and garlic. You can add back in lentils and chickpeas, which are also taken out of the diet. You can, there's foods in the diet that you're allowed in limited amounts. I think it's a quarter of a cup of pumpkin. You can have a tablespoon of peas, half a leek. All of those measurements are done with. You can start having those in unlimited amounts. If you're also being put on the SIBO dysbiosis and low histamine diet, we start with the FODMAPs. If you do well on introducing the FODMAPs again, we then start introducing histamines again. And we do it slowly as well.
Yeah. So Nicole, we really do see this in clinic, don't we? That when people are compliant, that they have incredible results, and the compliance is everything.
It's very true. It's yes, to get the results, you need the compliance. Yeah. And look, it's hard. I'm not denying it. It takes organization, and it takes prior thought to what, planning to what you're going to be eating the next day, but you benefit from feeling better. So it's all worth it in the end.
Yeah, that's right. So guys, the diet I think the one thing people don't realize about naturopathic medicine and nutritional medicine is that getting the diet right is the first thing you need to do, because it can completely adjust your biochemistry. And when you do that, you will improve your detoxification pathways, you'll improve your nutrient absorption, you'll improve your methylation status. And doing that is going to have
inflammation.
Yeah, lower inflammation. And when you do that, supplements are a bit of an adjunct. They're helpful, but without the diet, the supplements aren't going to be efficacious. So everyone, Nicole works alongside me to really, really help patients with SIBO get the diet right, get the supplements they require right. She looks at all the different blood tests that we need to look at nutrient malabsorption. And Nicole works with my patients just to ensure that they get the diet right, they get their bowels moving, they've got all the supplements they require to get the best results from SIBO. So thanks, Nick. Thanks for joining us. And I'll see you soon in clinic.
Okay, bye.